The thalamus is sometimes referred to as the gateway to the cerebrum, and thus obviously sensory information, such as the somatosensory information of touch and pain and temperature, must travel through the thalamus and be relayed to the appropriate area of the cerebral cortex on the somatosensory cortex. So thus there are nuclei of the thalamus which play this role in relaying somatosensory information. If one were to view the lateral aspect of the thalamus, there is a ventral posterolateral nucleus which receives this somatosensory input and then sends neurons to the somatosensory cortex in the parietal lobe. And this allows the cerebrum to be aware of the general senses coming from the limbs and trunk, but not the face, as we'll see. So touch, pain, temperature are relayed through this nucleus, and lesions can cause the loss of the feelings of touch, pain, and temperature from the limbs and trunk. In my animation, I have made the ventral posterolateral nucleus a bit transparent so that one can observe a deeper nucleus, the ventral posteromedial nucleus. This also projects to the somatosensory cortex, but it is projecting somatosensory information from the head. And so while the posterolateral is sending touch, pain, temperature information from the limbs and trunk, this region of the thalamus is getting information from the trigeminal nerve about the senses of the head and projecting that information. Lesions here would cause the loss of feelings of touch, pain, and temperature of the head. At the bottommost portion of the somatosensory cortex, there is the gustatory cortex, which is dedicated to taste. And so this thalamic nucleus is also getting input from the solitary tract, from the medulla, concerning taste. Lesions here can also cause a loss of the sense of taste. Not only does the thalamus relay somatosensory information about touch and temperature, and also the sense of taste, the thalamus relays information for hearing and vision as well, essentially all senses other than olfaction. The inferior colliculus from the midbrain projects to the medial geniculate nucleus on the underside of the thalamus, which then outputs to the auditory cortex of the temporal lobe to transmit information about sound. The lateral geniculate nucleus receives its input primarily from the retina, but also from the visual cortex and superior colliculus of the midbrain. And it outputs to the visual cortex of the occipital lobe, transmitting information about vision to the cerebral cortex.